This is Takoa Rogers, family nurse practitioner student at Albany State University, and today I will be performing an appendicitis assessment. If you have a patient that presents and you suspect that they may have appendicitis, may be positive for appendicitis, then you want to start with just a general inspection of the abdomen. You want to look, you're looking for any abdominal distension, or anything that would give you a sign that there is any fluid retention within the abdominal cavity. And once you do a general inspection of the abdomen, then you can move on and listen. And you want to listen in all four quadrants. We'll start with our right upper quadrant, and we're listening for vowel sounds or hyperactive. Listen in the left upper. We move down to the left lower. And then we will listen in the right lower quadrants. And you'll be sure to listen for a decent amount of time, 30 seconds to a minute, to assess for any abdominal sounds and vowel sounds. Once we listen to the abdomen, then we can move on and palpate. And in palpating the abdomen, we're pressing. And here you're assessing for any tenderness or guarding, also rigidity. Those are all signs of pain or signs of fluid retention in the abdominal cavity. And once you palpate, then you would move on to percussion. And with percussion, we're going to percuss in all four quadrants as well. And once we do our percussion, then we can move on to some actual specific tests that would show us or be an indicator that the patient is positive for appendicitis. One test we can do is the obturator sign, and with that you want to take the leg, kind of bend, cross the foot over here, and what I want you to do is don't let me push your knee down, push against my hand. And here we're assessing to see if there's any pain with this motion. And we would do the same with the opposite leg, push against my hand. And if there's pain there, then that obturator sign is positive, and that's an indicator of appendicitis. Another test that we can do is called a heel tap. And what you do with this, we just want to actually tap the heel with the leg straight. And with that jarring motion, you would get a response from the patient of having pain, because the jarring motion will cause movement in the area of the appendix. And another test we can do is called the psoas test. And with that test, you want the patient to, can you roll over for me just slightly on your side? Here. And you take this leg, and we want to hold it straight and pull back. And if they have pain there, then that's also a positive indicator of appendicitis. Another test that we can do is called the McBurney sign. And with the McBurney sign, then you want, with the patient lying flat, you locate the superior iliac crest as well as the belly button, and then you're going to go about a third of the way up from the iliac crest, and this area is known as the McBurney's point. And what you would do here at McBurney's point is press into the abdomen and then release, and you're assessing to see if there is pain upon release here. And if there's pain upon release, then you have a positive McBurney sign, which is also an indicator of appendicitis. That concludes my video. Thank you.